For me, I'll be happy to just talk for like the next one.
So the thing is, I was thinking if the program starts at 6, we have to wait like 1 or 2 minutes for people to join in. So that was why you see that the actual introduction and others will start at 6:05.
For any 1 or 2 minutes for people to log in. See, you have the Wi-Fi.
So when it's 6 o'clock, we should just start. Hello?
Without saying, I'm waiting for people to log in again.
All right, then if we are just going to start, then maybe Ted, you could use the opportunity to introduce InciSioN Ghana. What do you say?
Tell people, you have to start the same time. People should log in 5-10 minutes before we start.
Okay. Hello, Teddy.
Yeah.
Yeah. So I'm currently logged in, and there are some people that have logged in and logged out. I've seen here that it's
Time the link. Some people just try. You know how many times people have logged in the sheet?
Oh, okay.
So many times. Probably they were just trying the link to see if it will work.
All right.
Rain is noisy. Can you hear me when I speak? Okay, all right, that's fine.
Hello, can you guys hear me?
Yeah.
Is it faint? Is my voice faint?
Yeah, it's okay.
Thank you.
Can you guys not hear rain? Okay.
Good evening. My name is Dr. Amadou Munira. I'm with InciSioN Ghana, and we are the ones that put together this wonderful program. Thank you all for joining. We would like to start our program right now at exactly 6 p.m. So the host of this program will be myself and Nathaniel. So Nathaniel, if you could introduce yourself. Okay, it appears
Can you
my
hear me?
yes, now we can hear you. Yeah.
Right, so I'm Nathaniel Kassan, and I'll be the co-host with Dr. Munira.
All right, so to start with, I'm sure there are a number of people that are joining InciSioN Ghana's program or have heard of InciSioN Ghana for the first time. So we would like to start off by introducing the president of InciSioN Ghana, Dr. Theophilus, to say a few words on InciSioN Ghana, who we are, what we stand for, and what we hope to achieve. So Dr. Theophilus, the floor is yours.
Thank you very much, Dr. Amadou. Hello, everyone, to begin with. I'm really excited to be here this evening. My name is Theophilus Anyomi, and I am the chair of InciSioN Ghana and also a general surgical training with the Cambridge University Hospital. I'm really excited about this meeting, particularly not just because of my interest and background in general surgery, but also because we have a rich panelists who have accomplished a lot in the field in their respective roles in their universities and hospitals and Ghana as a whole. And I can't really wait to listen to them. It's really an honor to be part of this meeting. For those of you who do not know InciSioN Ghana, basically this is one of the national working groups of InciSioN Global, and that's the International Student Surgical Network, which is a not-for-profit organization comprising medical and public health students, residents, and early career physicians who are interested in the field of global health, surgery, obstetric, and anesthesia. And InciSioN actually started off as an informal working group of the International Federation of Medical Students in 2014 and was established as an organization in 2016. And we now have today we represent over 5,000 members to establish. So InciSioN essentially envisions a world where there's timely access to safe, affordable, and anesthesia and obstetric care for everyone, everywhere, irrespective of geographical background. And some of our core values include capacity building, education, and mentorship, and specifically equity, where everyone everywhere has access to safe, affordable surgical care. InciSioN accomplishes these activities through three main arms: advocacy, where we advocate for everything that has to do with equity in health, and education, where we educate ourselves about global health, about the surgical specialty, anesthesia, obstetric, and gynecology, which is one of the meetings we're having today. And then, of course, we have a research that aims to build capacity amongst members and make sure that the area of research is well covered by members of InciSioN. You may all be ahead of the InciSioN Ghana Research Mentorship Program. I'm sure a number of you are part of this program. And I'll just end on the notes that we are having our next webinar. This is a third of about 12, and that will be on May 27. And we have wonderful speakers, both PhD holders, both well accomplished in the field of general surgery. To continue.
Dr. Teddy, thank you so much for that. So as Dr. Theophilus mentioned, we have a very rich panel, and this panel requires their own introduction. So I'll hand it over to Dr. Nathaniel to introduce our panel, and let us all meet them.
Thank you very much. Thank you very much, Dr. Munira. So first of all, I'd like to introduce Professor Joe Natcleglamte. Professor Joe Natcleglamte is a professor of surgery at the University of Ghana Medical School and a consultant surgeon in the Department of Surgery at the Kolebu Teaching Hospital. He graduated from the University of Ghana in 1982. He's a fellow of the Ghana College of Physicians and Surgeons, the West African College of Surgeons, the Royal College of Surgeons, and the International College of Surgeons. He holds a postgraduate certificate in business administration from GIMPA. He's an alumnus of Mfantsipim School. Prof. Lamte has a research interest in breast diseases, the vermiform appendix, and oncology. He's passionate about training the younger generation of medical professionals. We also have, as part of our panelists, Professor Stephen Tabiry. Professor Stephen Tabiry attained a Doctor of Medicine in Kavok, that's in Ukraine, in 1997. He went on to attain a Doctor of Philosophy in clinical surgery at the same university in 2004, African College of Surgeons and American College of Surgeons. Professor Stephen Tabiry is also responsible for postgraduate training in surgery and the governor of Ghana College of Physicians and Surgeons Basic Surgical Science Training course, the Tabiry Teaching Hospital. Professor Tabiry is the Ghana National Lead of Global Surgery, and he has successfully established effective of building and sustaining surgical research throughout Ghana. He was recently at the Institute of Health Research on Global Health Units in the UK. We also have Dr. Kwabena Agbedinu, who is a general surgeon and a senior specialist at the Komfo-Anokye Teaching Hospital. He's a fellow of the West African College of Surgeons and a member of the Ghana College of Physicians and Surgeons. He's also an adjunct lecturer of the School of Medicine and Dentistry in KNUST. Dr. Kwabena Agbedinu is passionate about cancer care, prevention, and early diagnosis. His major interest is in breast and colorectal cancers. He's a member of the American Society of Clinical Oncologists and is currently a principal investigator for precision medicine for aggressive breast cancers at Komfo-Anokye Teaching Hospital. He has great interest in imparting knowledge and mentoring of the next generation of surgeons. He has a number of peer-reviewed publications and also has made oral presentations at international scientific conferences. We also have Dr. Victoria Gau Sena, who is practicing general surgery and is a senior resident with over 10 years working experience at the Komfo-Anokye Teaching Hospital, Police Hospital, Bato Catholic Hospital, Beta Accra Regional Hospital, and the Kolebu Teaching Hospital. She's an alumnus of the Akosombo International School, the KNUST School of Medicine and Dentistry, and a member of the Ghana College of Surgeons. She practiced as a specialist surgeon at the Greater Accra Regional Hospital from 2018 to 2021, and is currently a senior resident in general surgery at the Kolebu Teaching Hospital. As one of the few female surgeons in Ghana, she's passionate about women's health and is a strong advocate for availability of surgical services for all, regardless of one's socioeconomic background. She is married with 2 children. Now, the last panelist we have here is Dr. Yvonne Adofo Asamoah, who is a junior surgery resident at the Cape Coast Teaching Hospital. She had a senior high school education at the Tabiry Girls Senior High School and then proceeded to the University of Cape Coast, where she obtained her MBCHB. She remained at Cape Coast teaching at the Cape Coast Teaching Hospital, where she undertook all her 4 post-qualification rotations. She started her professional career as a medical officer at the ICU at the same hospital, where she worked for over a year. She became a member of the COVID-19 Rapid Response Team until her residency at the Coast Teaching Hospital. After residency, Dr. Adofo Asamoah hopes to pursue further training in plastics and reconstructive surgery. So we have introduced our panelists, and we are very grateful to have you here. On this note, I would like to say welcome to each and every one of them. And I'd like to proceed to call on Professor Stephen Tabiry to give us an opening remarks on global surgery, since he's the head of global surgery in Ghana. Thank you.
So Professor Tabiry, please, you've been given the chance to share your screen.
I've sent the slides to you, so if you can help me share it. But I think your program is divided into 2. The first one I'm supposed to do is to talk about global surgery, and I think the second one will be choice of surgery. So which one am I talking about now, or I'm speaking about now? First one, I can go with the global surgery, the impact in Ghana. And then from there, we can zoom on to, but it depends on what you have on the program.
Well, please, we were hoping to merge the discussion on global surgery and InciSioN in Ghana, so that maybe as we continue discussing the difficulties of general surgery, you can bring up some of the data you've been able to collect so far.
Okay, that is great.
Yes, sir.
Okay, so let me start by saying that I would like to congratulate the InciSioN Ghana to bring young and future leaders in surgery and to groom them up. I'll start by telling you a story, what we are doing currently with the global surgery. The global surgery started like what you have done. The history is that you get some few young surgeons at your age, and they decided that they have to go the whole Europe to do a research, of course, impactful research. So these young people are James Grasberg, Thomas, I forgot the surname, and then Dimitri, and then you have others joining them. So the first research they did was to go through, do appendicectomy outcome in Europe. So they were able to connect all their peers in Western Europe, and they did a great study of outcomes of appendicectomy performed by consultants, performed weekends, performed during odd hours, and performed during the working hours. And the results of such of the research was so impactful that it changed the approach of appendicectomy in Europe. So they continued, and then they did another research, and that gave birth to what we are currently doing, which is called global surgery. There are various aspects of global surgery. Global surgery is when they send their residents to Africa to do something, to learn something about what we do, or learn some things that we do in Africa. That is one aspect of global surgery. But the question some of us started asking them at the international platform is that, is global surgery only people coming to low and middle income countries? What about low and middle income countries also coming to you, or do a research together so that you improve the outcome, the research output from low and middle income countries? Because if you look at impactful research in medical science, about 2% comes from, about 1% comes from Africa. I mean, when you talk about sub-Sahara, then out of that 1%, South Africa is the one who is having about 80% of that 1%. So that means that the whole world, West Africa or sub-Sahara, is contributing less than 0.5%. So what can we do together to also build capacity, build future leaders in the sub-Sahara region? So we started practicalizing what the Lancet Commission recommended, that improving safe surgery and anesthesia. So based on what these young surgeons or young doctors did in UK, started from University of Edinburgh and then University of Birmingham. We built on that, and we were able to conduct a research recruiting. The first one was Global Surgery 1, over 10,000 patients from over 700 hospitals, and low and middle income countries took part. I started it. It was difficult to get some hospitals, but because we got the results from Global Surgery 1, we moved to Global Surgery 2. Then the number of hospitals increased, especially in Ghana. Then the Global Surgery 1 and Global Surgery 2 were cohort studies. That means each hospital will collect the data within 1 week. Of course, depending on the size of the hospital, you can form 2 teams, 3 teams, and then each team will collect data on outcomes of abdominal surgeries for 1 week. These are the 2 cohort studies. And then we realized that surgical site infection is a major problem if you compare to that of high income countries. I think it was in excess of 40-something%, especially if you're considering dirty and contaminated surgery. Clean surgeries, no problems. So we didn't consider clean surgeries at all. So based on that, we were called to South Africa, Johannesburg, but I think at that time, Teddy was the only youngest person who took active part in Global Surgery 1 and Global Surgery 2. So Teddy was the part of the team that established a protocol to test an intervention that has been recommended by WHO, says that, okay, if you use 2% alcoholic chlorhexidine, it is superior to povidone iodine. But the WHO is saying that that is not, the recommendation is not 1A. That means that we don't have enough evidence to say that that recommendation works or not. So I think together in Johannesburg, the youngest surgeon or the youngest doctor at that meeting, I think, was Teddy. And they were able to divide this, develop a protocol to test alcoholic chlorhexidine and povidone iodine. So what that did to us is that I think we all know where Teddy is. Teddy is flying in UK because of his participation. And I think if Teddy will share his experience, when he got there, of course, he could do appendectomy like a registrar. But they said, no. We can teach a dog to operate appendectomy. But why you have to do it this way, not that way, or when you meet this one on the way, it's only human beings that can do it. So Teddy, we won't allow you to do appendectomy, but he was lucky. He has done a lot of major publications because he was involved in global surgery 1, global surgery 2, global surgery 3. And as I said, he was part of the team that developed the protocol for the intervention, testing the intervention of povidone iodine and chlorhexidine, and then triclosan sutures and the plain sutures, which most of you on this platform are aware, which is called Falcon trial. So the Falcon trial protocol, Teddy was part of it. So of course he gave him leverage. So what it means is that Teddy comparably was higher than his peers in the United Kingdom. That is what research can do. And that's why I started by saying that to teach someone to operate appendectomy, but if you operate appendectomy, and I think most of you have done a lot of surgeries, but if I ask one of you to say that, what is your individual outcome in laparotomy? You will not be able to say. You don't know. You don't have any idea that, for example, I'm a medical officer or I'm a resident. I'm involved in 120 surgeries. Out of this, how many died within 30 days? How many developed complications? Which complication did they develop? This is what people want you to do as a young man. And again, also growing leadership. So we did a Falcon trial. It is a big success. It went into Lancet, and I think all of you here knows what it means to publish in Lancet. With individual efforts, maybe it would have been extremely difficult. But if you believe in a collaboration, then you can perform your own record. And let me chip in with the fastest man on earth today. People believe that Usain Bolt is the fastest man on earth, but Usain Bolt is not. Because if you put 4 people together to run 4 times the distance of Usain Bolt, and these 4 people believe in collaboration, they are able, together with the Usain Bolt himself, they were able to beat the record of Usain Bolt by 30 seconds. So that is what is meant by collaboration. So you see that Usain Bolt in a team of 3 collaborators who believe in absolute collaboration are able to beat his individual records.
Professor Tabiry.
Yes.
Sorry, please. I just wanted to let you know that you have 1 minute left.
1 minute more. Okay. So
yes,
let me conclude. So what I want to say here is that then the impact of global surgery in Ghana, a lot of people have won scholarship. Teddy, Emmanuel, through the same collaboration. Now we have 4 people going for scholarship for the postgraduate level. What we want to achieve is that we want to grow leadership in Ghana. Today, we have about 3 people applying for scholarship to go for general surgery fellowship level in the University of Edinburgh. One from Kolebu, one from Efiam Kwanta, one from Tamale Teaching Hospital. And then at the membership level, Teddy has completed with distinction. Gemfi, Bando completed with merit. They were the first batch. And then we have about 3 with Dorcas herself on top. So that is, I think I don't have much time. I didn't know the time. So again, that is what the global surgery. So we want to grow future leadership so that people will become full professors, not when they are 55 years or 60 years, or when they are about to go on pension, so that you guys can become professors at the age of 35, 38, or 40, so that you can practice and gain more experience. Now, just to say something, a few seconds on choice of surgery. We've done statistics. We collected some data to find out what is happening. I think people answer the questions why they're going for surgery. If they're going for surgery, what is the challenges? And I think the highest was that the program is not structured. It's not structured. I mean, again, low pass rate was a problem, and the people don't have time during the program to learn and do self-study because the attention is the provision of the service. So thank you very much for the opportunity.
Thank you so much, Prof, for educating us on global surgery and what we need to do. So moving on to the next part, again, to reintroduce our panelists, we have Professor Stephen Tabiry with us, Dr. Agbedino Kwabena, Dr. Victoria Senagawu, and Dr. Yvonne Adufa Samoa. They will be with us today as we talk about global surgery. We'll be asking them some questions. Some of them were given to us that they had wanted to know from these our senior colleagues, but if with the responses we'll be getting, anybody else has any questions, they can please put it in the general group chat. We are also expecting the presence of Professor Jonas Pleglamte to also join us and help us answer some questions. So if our panelists could please turn on their mics and also their videos so that our audience will be able to see you, because I think some of them might be meeting you for the first time. Lovely. Right. So to start with, we would like to start with Dr. Agbedino. So this is a question a lot of people always want to know, that why did you pick general surgery of all the specialties open to you? Why was it general surgery you decided on? Doc, please, if you could unmute your mic. Dr. Agbedino, please, we can't hear you.
Can you hear me now?
Yes, boss. Yes, please.
Yes. Okay. Okay. I would say I'm honored to be here. I'm excited with InciSioN Ghana giving me such an opportunity to discuss such a very interesting topic and opportunity for mentorship. Prof. Stephen Tabiry, who is a mentor of mine, to share the same platform with him. Prof, incidentally, I was part of the first global surgery one when you look at the surgical site infection.
Yeah.
I did work with Prof. Jedu as well.
Yeah.
We are thankful for you bringing global surgery to Ghana, the opportunities you are giving to us, the youth, in being part of research. And as you said, growing our capabilities. along the way as faster as possible, so that we will not be old men before we become professors, as we said. Choosing general surgery was initially a battle. I was excited with variety in terms of the practice. I spent some time in trauma and orthopedic, and initially everybody thought I would do trauma and orthopedic, but I had my challenges there in terms of mainly the routine nature of the work, and sometimes, in my view, lack of excitability in terms of the management of complications and preoperative preparations of patients. And in general surgery, it gives you the opportunity to look around and treat various cases. One day you are dealing with breast, the next moment you are in a thyroid, the next moment you are in abdomen. And such variety excites me a lot. And the chance to solve a patient's problem completely, and the joy on patients' faces when we were able to remove the focus of the disease, was what really motivated me to join general surgery. And looking around to the opportunities for further studies, career progression was there in general surgery. And the need, now we'll talk about global surgery need, we need people in general surgery to come and handle the burden of disease. And that's some of the points I used to choose general surgery.
Thank you so much, boss, for your answer. So to Dr. Victoria, as I'm sure you are aware, in your field of practice, general surgery is very much a male-dominated field. There are very, very few women in general surgery. So we also want to hear from you as a female surgeon. What made you pick general surgery, and how has it affected your ability to balance a work-life balance?
Thank you. Thank you very much for having me on this platform. For me, choosing general surgery was fairly easy because during my house job and MO time that I spent in the district, the results were quite rapid, and like Dr. Kwabena said, the joy on patients' faces, it's not a very prolonged management for most of our patients. So that's something I wanted to do, to have quick results for the patients and for them to be out of the hospital as soon as possible. Being a female surgeon is quite challenging, I must say, and especially if you are to balance it with family. But then what I can say also is that you would just have to plan in such a way that you would make time for family as well as the job. You shouldn't let the job take so much of your time, but then you should just make time for family also. Again, it's quite challenging. I think it's very much different for the men than for the women, but choosing general surgery, if you are in love with it, you should be prepared for the challenges as a woman.
Okay. My next question is to Dr. Yvonne. So to Dr. Yvonne, when you were deciding on general surgery, I'm sure you noticed that a lot of the people that got the chance to do the residency were male. And having done the residency program for the last year, what difficulties have you seen that are peculiar to females? And what do you think we should do as fellow clinicians or doctors to help entice more women to consider doing general surgery?
Hello. Okay, I just want to say a good evening to everyone who has joined us. And thank you to InciSioN Ghana for giving me the opportunity to be part of the panel for this discussion. So yes, I noticed there were a lot of male colleagues who wanted to vie for in the residency position, but I wasn't moved, I wasn't fazed. It was something that I wanted to do, was something that was something that I was interested in all the way from medical school. And so going into it, I wasn't really phased. I had mentors who would tell me exactly what to expect in the rotation. And so my mind was made up, and I was going to deal with the challenges as and when it came. So with females who want to go into the residency program, I think it's all about having a mentor, having a good number of healthy relationships with people who would encourage you along the line, people who would tell you, hey, it's not easy, but then you can make it, people who would encourage you as the rotation gets difficult, as the journey gets very difficult to navigate. But at the end of the day, I think with being a female, surgery shouldn't be something that you cannot pursue because you think you cannot balance it. So far as you've made up your mind to do it, you should be able to do it. Thank you.
Oh, lovely, lovely speech. Prof. Tabiry, please, I have a question. It's a question that might be considered controversial, but it's also open to other members of our panel. And the question is, Prof, do you think that general surgery as a specialty is becoming extinct?
It's becoming what? I didn't hear the last part.
Extinct. Do you think that general surgery as a specialty is dying out?
Yes, I think so, because general surgery needs the numbers. And if you don't get the numbers, because it seems trauma, orthopedic, and urologists are overtaking the general surgery specialty. But it should be the opposite, because as other panel members have already mentioned, it is the basis. And even if you go to medical school, the curriculum, 80% of the curriculum in the medical school is general surgery. But if you look at the number of general surgeons coming out, you ask yourself, are we going to? So maybe if you show some of the slides, the difficulty people are having with general surgery, I think I must say, and I'm disappointed, is the pass rate at the fellowship level. Let me give you 2022 analysis of fellowship exams at the Ghana College. If you take urology, 2 people sat for the exams and
We all pass.
Naturally.
I think I went off. So if you look at urology, 2 candidates sat for the exams and all pass. Trauma, 2 people sat for the exams and they all pass. In general surgery, trauma, 1 was a resit and he passed. So that makes it 100%. But if you look at general surgery, 4 candidates presented for the exams and only 1 passed fully. So if you put it together, that is 25%. If I'm a faculty chair, if I'm a rector of the college, I may worry and ask myself a lot of questions. Does it mean that the candidates presented for the urology are better or are clever than those who sat for the general surgery exams? We need to investigate that. We need to interrogate that. We need to find out from the candidate, what do they think about the program? And then recently, I quickly put some questionnaire there when you inform me about this program. And you realize that most people like general surgery. I think about 51.3% says they will go for general surgery out of from the 47 who responded to the survey. But majority of them says that the program, about 17% says the program is not structured. Again, around 17% of the participants says that there are no mentors. That means that you wake up, you go to the hospital, it's not structured, who is teaching you what, who is doing what, who is doing what. majority, some about 12% mentioned the low pass rate. Okay, so irrespective of all this difficulty, 51.3% say they want to go for general surgery as a subspecialty. So I want to expand this work for people to, we get more people, potential residents, house office, medical officers, house officers throughout the nation, so that we've got a data that represents the whole nation. And then we'll present it at the college to those that matters and say that, okay, this is what the residents are saying, because it's an adult study. An adult study is not SS, and then you push everything through the throat of an adult. Once in a while, you have to go to him or her or to them to find out what is the problem. And we need to do more study to find out why pass rate is 25%. Of course, it's only from 1 year. Then we have to analyze for the past 5 or 6 years. And then we come out with what is wrong, what there are people who are potential candidate things, and then we try to modify.
Hello, Prof. I think you've gone off again.
To add something to it before Prof comes back,
Yes.
I agree with Prof. General surgery is getting extinct, and I have mentees who come to me very interested in general surgery, as Prof alluded to, but they're always worried, will I pass? The pass rate is a concern, and I think we have to look at the training. And our professors, they need a mind change as is going on in urology, trauma and orthopedic, cardiothoracic, neurosurgeons, neurosurgical profession. And this is really affecting us so much as general surgeon. People are not coming in because they want to, they have a shock of my life. Somebody have actually encouraged so much to do general surgery. And they called me today and said that he has gone for the interview and want to do plastic surgery. Why? The program is difficult, it might be of long duration, and you will not be easily passed. That's against plastic surgery that he knows that when he gets into the program, comes over 3 years, is out. And that is what is affecting our numbers. Though we are the bedrock of surgery, and the surgical burden is on us, our numbers are going down. We need to make general surgery attractive. And I'm happy Prof is looking at a study like that. Prof, I'm with you. We can look at this study together as collaborations, and let's see how to get a data. Well, I did one with they do about the impact of specialists trained by Ghana College in Ghana, and was quite an impactful study as well.
Okay.
I think to also add to what Dr. Agbe is saying, and Prof, from the study, yes, 53% responded they are interested in general surgery. But usually what happens is after going through the membership, by the time they are exiting, coming back, they've changed their minds. They don't want, because of all that they've seen happening in general surgery compared to other departments. So again, like we mentioned, the pass rate is a big concern. And I think most surgical trainees believe that general surgery is not lucrative. That's also an aspect that they are looking at, that it is not lucrative. So it's up to us also to look into that and do something about it. I think that's also one of the major reasons that it's not lucrative enough compared to the orthopedics and the neurosurgery and plastics, for instance, or urology.
Okay. Thank you very much. We are lucky enough to be honored by the presence of Professor Jonas Clegg-Lamte, who has joined us. Professor, right now we're just talking about a topic where we're looking at whether or not general surgery as a specialty is becoming extinct. I wanted to ask for what you think. What are your opinions? Do you think general surgery as a specialty is dying out?
Right. Yeah, thanks for the question. A few years ago, if you had asked me, and I would have said yes, it was becoming extinct. At the moment, I don't think so. I know that numbers are low. I know there are a lot of problems, but if you look at the last few years, let's say 5, 6 years up to now, um, we have more people coming into general surgery. There was, I think, a whole year or two where no residents really entered, and we had residents coming from Nigeria and so on, but not even one person entered the general surgery. So that is that. Yes, there are problems, and I do identify with a lot of the things that have been said. The last exam, I know Prof. Tabiry showed you the graph where there was one pass. That was, in other words, the person did not have a provisional pass, they had a full pass. But as I recall, there was certainly one or two at the school passed, but they had provisional passes. In other words, they had to correct something in their dissertation. And certainly I had one sent to me and I returned it immediately and the person has passed. So really, the pass rate is more than 25%. But the problems that have been mentioned, I think, are very real. Let me tell you that experience that we had in general surgery in Kolebu, we realized that we had the tendency of, if you like, not concentrating, but to some extent concentrating on the membership candidates, because all the membership people are business, if you see what I mean. But if you go to urology, their business is just those doing urology. So they tend to pay more attention, or all their attention really, on the fellowship candidates, those who are doing urology or those who are doing plastics. So that's really all their business. Whilst we kind of are trying to prepare people for membership. So we realize that, and I think we've just had one run where we try to get the senior residents to be, and the main problem has been dissertation, if you ask me, which affects the pass rate and so on. So we try to now organize them, come and present your proposal, come and do this, try to correct it, and so on. But yes, I do identify with that. And what we intend doing now is to look at the past, what we've done. The first round we did with the residents who have presented their proposals and dissertations. Some of them have submitted already. Is to look at it again and review what we've done and see whether or not we can fine tune it better. Okay. But so that in terms of is it structured, that word structured thing, I think that's where the problem lies, is that if you like, the membership program tends to take all the attention of general surgery, and therefore the fellowship people suffer as a result. But I think we've certainly realized that in Kolebu, and we are trying to do something about it. For the remuneration, there's something we can do about it.
Yes, good. Prof, please, for the benefit of the medical students that are part of this discussion, could we know which facilities one can do their membership in general surgery if they are so interested in?
Right. So at the moment, you can do it in, let's start from the top. So you can do it in Tamale, you can do it in Kumasi, you could even do it in Sunyanyo. I think they have only one place also. Cape Coast, Kolebu, 37, Ridge, Kufuridwa also are taking now. I think. It's generally a policy to increase the numbers as much as possible. So the faculty board tries to do accreditation visits in many, and Tema Hospital as well tries to do accreditation visits. Some of them can only take 1 or 2 residents. Some have only partial accreditation. In other words, you can do your general surgery rotation there, but if you need to do, say, cardiothoracic or plastics, you may have to go to another hospital and do that for the 3 months. But there are now many places where you can do it now. And at the interview, you are asked to choose. You have a first choice and a second choice, and even a third choice where you would like to do your residency. So people are free to choose. The only problem is that sometimes places are oversubscribed, in which case, it becomes a little problem. But yeah, there are many places now.
All right. That's very, very lovely to note. Dr. Agbeduno, earlier on when we asked you what made you consider general surgery, you said you very much enjoyed the excitement, the fact that there were so many parts of the body that you can look at. You're not just confined to one part of the body. But if that is what you enjoy most about general surgery, what is it about general surgery that you dislike and you hope maybe moving forward might change?
That's an interesting question. The fact that in general surgery, you need the collaboration of a lot of staff to make your work very proficient and go on well. And the interaction with these members, if they don't have your mindset in terms of the result you want to achieve, you have challenges. And here in my local area, you can have difficulties in going to theater, just operating your case. A case that will take 1 hour, you might wait for 3 hours just to do that case. And it's challenging to most of us. It affects our output. Time spent in theater, though we enjoy the case, having hands-on from the nurses, anesthesia team, all this, everybody coming on board to make sure that your work goes on smoothly and having the outcome you want is my major concern and difficulty, especially in my local area. I don't know what Prof. others will say.
Actually, it's interesting you say that, because for me, that's the reason you give for doing general surgery is the same as me. I was excited by the fact that there was so much to do. I mean, it was a very exciting field for me. So general surgery is exciting. But I think, as Senna said, it may not be that lucrative for some people, but it's very exciting.
But we need to work on the lucrative aspect. The orthopedics have their implants. They mention the implant and they get some good money, and it's affecting the younger people. Now the younger people are really in this fast system. They want to get the money quickly. And when they see us and they look at how we are struggling, they say, then I will go to orthopedics, I'll go to urology, and post-state, they will put the money. So let's restructure the general surgery unit and get more money as well.
I think, Doc, the thing is there's no investment in general surgery. I think general surgery in Ghana means that maybe in Tamale, typhoid perforation, gastric perforation. In other places, it means different thing. Okay.
Exactly.
But the issue is the investment. And I would like to say the government, the hospitals are not investing. We as general surgeons are also not investing. So the other area to invest to get what you are talking about is if the government and the hospitals are not interested in investing, for us also to enjoy, it means that we as individuals should also find a way to invest. I'll tell you a colleague in Tamale, urologist, the hospital is not providing anything, but he's been able to buy endourology set, which is using to provide a service, either in the hospital or outside the hospital. And it looks very good. So I think the bottom line is investment. The hospitals are not interested in investing in general surgery because they want you to operate the acute abdomen so that more money will come in. So what does it mean to invest and then buy this expensive thing if you can do with your hands. So there are other alternatives for us.
It's what laparoscopic surgery will bring.
Correct.
Some money, yes.
Yes. And we can't get it. General surgery is going to be difficult to convince anyone and say, well, invest in laparoscopic surgery. So the other alternative is we ourselves form a team, invest, and reap the benefit. Thank you.
Welcome. It's almost time for us to wrap up our program. So we'd like to end by asking each of our panelists one last question. And I'd like to start with our junior resident, Dr. Yvonne. So the final question we'd like to ask is, what advice would you give medical students or junior doctors considering general surgery? Hello, Dr. Yvonne, can you hear us?
Yes, I can hear you now. Okay, so the advice I would want to give my junior colleagues and including medical students is that, well, if you decide to do surgery, it requires a great deal of sacrifice. But at the end of the day, it's very rewarding when you think about being able to see how your patients, they coming in a critical state, and then the next day they're smiling at you, being all thankful because of what you've been able to do for them. But then the sacrifice that has to do with sacrificing your sleep, your time, your personal relationship with family, all of those things, it's something that when you are able to find a balance as in like if you have problems with when you have issues with how to manage your time and how to manage your family, if you are able to strike a balance, then you can navigate your way through the program as a surgical trainee or as a medical student who intends to do surgery. And the other way to also look at it is, even though surgery is difficult, if you are able to find someone who would hold your hand and say, okay, yes, it's not an easy task, it's not an easy training to find yourself in, but I'm going to guide you through it. I'm going to help you. I'm going to be your mentor. I'm going to say that, yes, today you're not feeling too well. If you want to take a rest, yes, you can go home and get that rest. If you are tired and then you want to take that break, that needed break, you can take it, because the journey is stressful. The journey is one that is not easy. So, having a mentor, choosing a mentor to be able to guide you through this is something that is needed as someone who's considering surgery. And being someone who wants to consider surgery, I feel you should show genuine interest in the program. If you're a junior resident or if you're like a house officer, a medical student, and you tell your junior that you want to do surgery, and yet you prepare a patient and you don't want to be there for the surgery, how then do you get a mentor? How then do you have someone to guide you? So I feel as junior colleagues, yes, we should have genuine interest in wanting to pursue surgery, so that if there's someone who wants to guide you, they can do it. Thank you very much.
Thank you to Dr. Yvonne. To Dr. Victoria, our final question to you is, in your journey so far, is there anything you regret or that you wish you could change? If you could talk to a younger version of yourself, what would you have done differently to get to where you are now?
I think for a younger version of me, I would want to have planned better my family dynamics, in that for young ladies wanting to enter into general surgery, if you do want family, then you should decide, do I want to have my family or do I want to have my babies back to back before I enter the program or during the program? I had a baby during the program and it was very, very, very stressful. So as a female doctor wanting a family, you would have to decide what you want to do. General surgery, we've already mentioned, is quite stressful. So if you're also interested in having a family, then you decide you want it before the program. If you are going to have children during the program, then that's going to be stressful, or after the program. So that's an advice I'll give a younger patient.
Okay, Dr. Victoria, thank you too for that. To Dr. Agbedino, I'm sure you've been part of several programs. In fact, this one, for example, we keep talking about empowering women, encouraging women to join surgery, but sometimes we forget the male perspective. So we want to ask you, are there any issues that are peculiar to men in surgery that our male counterparts interested in general surgery should be aware of?
Yeah, this is a difficult question. Men naturally might lose concentration along the way when there are difficulty. The women are quite persistent when they decide to do something. And in the residency program, there have been cases that some people have left the program, actually in the fellowship program for general surgery, because of challenges they have and relationships with their seniors and mentors. And I'll encourage the men to be aware of that. And once you have decided to do the program, you all into it, be dedicated and hardworking. And of course, the seniors will come on board in mentoring you to complete the program. And don't lose focus at all as you move along the program.
Okay, thank you. Professor Clegg Lamptey, please, we want to find out from you, what is the potential for further training following residency? If someone does the membership and they tell themselves, okay, I'm done, I'm now a general surgeon, what else can they do? Who else can they become?
Thank you. There's a lot. In the advanced countries now, people are going to various things. So when they say general surgery is dying, in those places, they mean people are going to different places. So let me give the example in Kolebu now. So we have people who are just doing breast, upper gastrointestinal surgery, hepatobiliary surgeon, colorectal surgeon, a vascular surgeon, and so on. So there are many opportunities for doing that. We mentioned investment, and if I may just say something about it, we've often criticized governments, especially because sometimes they buy expensive equipment, put it in a hospital where it is never used, whilst it's needed somewhere else. My advice to young surgeons quite often is get training in a particular part you're interested in, and then you can get your hospital to get the equipment. I mean, that's how we got laparoscopic surgery in Kolebu, for example, because I came with the skills. We had a listening chief executive, and he got the equipment, and we did it. And we've seen it in the subspecialties in the hospital as well. Once you have the skills, it's not too difficult to get the equipment. Because what they don't want to do, and we really don't also want, is for them to buy all sorts of equipment and put it in all sorts of places where they are not being used, when we need other equipment in other places. Okay, so there are opportunities, and mentorship is important. If nobody is mentoring you, you grab a mentor, grab somebody who can be a mentor to you, and they will hold your hand through it. But general surgery is exciting.
Yes, sir. Yes. So our next question is to Professor Tabiry. Prof, please, what we want to know is, in looking at the time you've been in general surgery, how general surgery was earlier, how it is now, how do you think it will be like in the next 20 years? Professor Tabiry, please are you still with us? Okay, I think Prof may have either left or may be having issues. Then if it's that, we'd like to redirect the question to Professor Clegg-Lamptey. Again, what we want to know is looking at all the years you've been in general surgery and how you have helped develop general surgery to be what it is now for people like myself and Dr. Yvonne to be in the program. How do you think it will further develop in the next 20 years? Or how do you hope it will develop in the next 20 years?
How do I hope? I hope general surgery will attract a lot of very enthusiastic young men and women who will raise the bar of practice. I mean, we unfortunately, our population is such that a lot of people really need, if you like, very general services. But my hope is that as we improve and get more general surgeons all over the country, we'll be able to raise the bar and offer people so much expert help that people will not need to travel out of the country and have treatment.
Prof, to add to what Prof said, I think in the next future, we will really be going to the super specialization. We're not be doing maybe the initial general surgery before we go into colorectal and hepatobiliary. People might just move straight from the membership level to these highly specialized fields so that the number of years spent will be lower and we can have more impact on our people. And in terms of other skills, bariatric surgeries, transplant surgeries, we'll be going into it. And I know Ghanaians are highly skilled to acquire anything possible, and we're practicing it. It's going to be exciting. The young people should get on board. We are the future. Let's come on board and do these things for our people.
Okay, so we are wrapping up this part of our program. I'd like to say a very, very big thank you to all our panelists. I know you are all extremely busy and you took time out of your busy schedule to come and be with us. We are immensely grateful. We would like to dedicate the next 10 minutes to answer some of our audience questions. We have some questions in the audience we'd like to direct to our panelists. This part of the program will be taken over by my co-host, Nathaniel. Nathaniel, are you there? Okay. If it's that, then we'd like to start. Nathaniel, are you with us now? Okay. So the first question we got was, how can medical students and junior doctors interested in general surgery seek mentorship? And how can they maintain a strong mentor-mentee relationship? So this is to our panelists. Professor Tabiry, if you are with us, maybe you could help us answer this question.
Okay, thank you very much. I'm back. I think mentorship is key. And I give my own example. When I arrived in Ghana, I was happy to have Prof. Clegg-Lamptey and Dr. Duaye as my mentors. I mean, they were my examiners. So at the end of the exams, the question was asked, where do you want to go? I said, well, anywhere that I'll be able to practice what the skills I have. And I think they were so happy. And I think Prof. Clegg-Lamptey continued to support. And I'm very grateful to him for the support I got from him at the initial stages, not only from him, but from many others, Prof. Abantanga, and then Prof. Ifua Hesi. So mentorship is crucial, irrespective of your level. Once you enter into an environment, you need someone to mentor you, to guide you. So what I would say is that the young doctors who are interested, please start identify mentors. Of course, most of the mentors are very busy, but once you persist, and I always say that there's nothing under the sky a human being cannot achieve, because we are created by God in such a way that we are supposed to do everything under the sky. But you need support, you need mentorship. So identify mentorship as early as possible. You may write an email, you may not get time to answer. Don't worry, push. One of them recently traveled a distance because he has been sending email. Sometimes I answer, I'm not able to answer detail. He came to my office, he came to me, and we're able to sit down. Then within 5 minutes, what maybe 30 minutes of responding to his emails could have done, we were able to solve it in 5 minutes. He presented a proposal, I look at it, questionnaire, we look at it on that same meeting. So keep on knocking until you get the right mentorship. Sometimes it may take investment, it may take time, but you need to do that. Because I always say that writing a letter has different interpretation when you meet a person. Because the sentence, you may understand it, but that's not exactly what the person at the other end is writing. So meeting people, talking to people, looking for opportunity is the way out. Look for mentors. They are very crucial, and you need them to grow.
Yes, of course.
Thank you.
So unfortunately, we only have time to ask one more question. And the question we have is from a medical student who wants to know that as a medical student interested in general surgery, is there anything special that she should be doing in order to help achieve her goal of becoming a general surgeon? Maybe Dr. Victoria, if you could help us with this question.
Well, as medical students, what you need to do is for surgery, you need to know your anatomy, basically. So yes, you need to study hard all the areas, but you need to know your anatomy and your physiology. Those two have to be really, you need to be very good at those two in order to be a general surgeon, amongst all the other subjects you would learn also.
Okay, thank you very much for that. Once again, I'd like to say a massive thank you to our panelists for taking time out of their day to join us. And also to our audience members, thank you. Today is a Saturday. For some of the medical students, they might be resting. For others, they might be going out to relax, but you decided to join us for this program. We are immensely grateful. InciSioN Ghana, like you mentioned, with the education series, almost every month or every other month, we try to focus on one specialty of surgery. We initially met the ENT surgeons. We've met the general surgeons now. We will send out a poll to decide which next group of surgeons would meet, and we hope that when we do, we would get you all to come, listen, and also help contribute to the discussion. I would like to give time to our secretary, Dr. Dorcas, to give a short announcement and closing remarks.
Thank you very much, Munira. Before I start, I'd like to say a very big thank you to all our panelists. It was very amazing to have you say yes to us. We really look forward to having future collaborations with you. And I also thank all our participants who have joined us today for such an interactive and insightful discussion. I just have some few announcements. I think we are about 15 minutes behind time. I'll try to get this done quickly. We have Global Surgery Day, International Global Surgery Day, which is coming up on the 25th of May, 2022. And the theme for that, the international theme is Education in Global Surgery. And we have some few activities upcoming. The first one is Global Surgery during Humanitarian Crisis, Challenges and Advances in the 21st century, which is going to be a webinar coming up on the 25th of May from 3 to 4 p.m. I would post the registration link in the chat very soon. The next activity, it's also a webinar on avenues for healthier collaborations, global surgery, coming up the next day, which is 26th of May from 3 p.m. to 4 p.m. And all are invited. As Munira said, we have our research webinar. That's the third webinar coming off on the 27th of May 2022 at 6 p.m., a 1-hour session, which is going to talk about ethical considerations and gaining study approval and undertaking patient consent. At this juncture, I would like to say a very big thank you to everyone for joining us today. Yeah, I'm done.
All right, thank you very much. So with that, I would like to once again thank everybody for their time and formally draw this meeting to a close. I hope you all have a lovely evening, and hopefully in the next few weeks for our next education series, we'll be able to meet once again.
Bye.
Thank you. Bye-bye.
Bye.
Bye, everyone.
Thank you, everyone. Bye.
Bye.
Bye-bye, everyone.